Welcome back to Flying Upstream, where we explore the lives of people who've chosen to rise above the current, question the status quo, and live life on their own terms. I'm your host, Kristyn, and today's guest brings both science and soul to the conversation about chronic illness, healing, and what it really takes to get your life back when conventional medicine has failed you. Dr. Brad Montagne is dedicated caregiver and a functional medicine practitioner with decades of research, clinical experience, and deeply personal insight. He's helped countless people who've been told there's no hope, people who've seen doctor after doctor only to still feel stuck in pain and confusion. What makes Dr. Brad's work different is that it's rooted in the pursuit of the root cause, not just managing symptoms but unlocking real, lasting healing. And he doesn't just teach this, he's lived it. After battling his own chronic illness and learning how to free himself from it, he now walks with others through the same transformation with compassion, wisdom, and faith. Dr. Brad, we're so glad to have you. Welcome to Flying Upstream.
Well, thanks for the invite. I think this is going to be a lot of fun. This should be a good conversation.
Absolutely. Let's start with your personal story. So, you've said that your journey into functional medicine came out of your own battle with chronic illness. What was that experience like, and how did it shift your path?
Mine started at the ripe young age of 5 years old, middle of the night in a hospital room, emergency room. What brought me there, that's not so relevant because this is what everybody experiences. No answers as to why. Just do this. Will calm the symptoms down. No idea on what caused it, how to avoid it, anything along that line. Just here you go. And I'm 5 years old thinking, there's something wrong here. There's just something wrong here. I don't know how many times I went back with the same type of thing, but I woke up in the middle of the night with gut wrenching pain. And I mean gut wrenching. I got an extremely high pain threshold. I've I've had I've had pain so strong that it's put me into shock and I can still function, but I'm going into shock. So that's not a common experience. I don't have a light pain threshold. So that led into global fungal infections. I got, we went on a family vacation when I was probably about 7. I came back and the whole world spun around me. My vertigo was so bad, the world literally spun around me. And I had to walk like a drunken sailor with a real wide stance, extremely coordinated, fast reflex, very athletic, with the world spinning around me all of the time, ready to puke my guts out. I learned to start to cook by myself at 5 years of age because if I ate what the rest of the family ate, I was sick. And I mean, really sick, ready to puke. So I started cooking when I was 5 years old, figured out ways to cook so I could eat so I didn't feel so bad. And that led me in this lifelong pursuit of what do you do to manage all these things that just make you feel like you're ready to puke your guts out, keep the world from spinning around and living. It gives you extreme concentration and it builds a character inside of you having to struggle from that age, not knowing anything else, but just wrestling to stay alive.
I can only imagine it must have been so scary, in addition to painful. And just having, as you said, being forced to have that level of focus just to do a simple task must have just been overwhelming. And I certainly appreciate about your journey that you went through this extremely difficult time as a little kid, and now you've built on that to create your own practice, and now you work with people who have seen multiple specialists, still haven't found relief. Why do you think conventional medicine often falls short when it comes to chronic illness?
That's a pretty simple answer. I was asked to do a talk on a summit on education of all doctors. So I looked through all the schooling and all that, and it ends up chiropractors and medical doctors have the same clinical sciences. The naturopaths and homeopaths don't. They don't have those classes. I was kind of shocked about that. But way back in the early 1900s, Rockefeller and Carnegie bought a bunch of shares in pharmaceutical industry, Merck and Pfizer. Rockefeller had the idea, how do we increase our profits? He set up two colleges, the University of Chicago and Chicago University and Rockefeller University. They started a program of science to base medical education off of, with an emphasis on research. Sent out two brothers, the Faulkner brothers, to go survey all the medical schools. They came back, they sent them out in 1905, came back, put their report out in 1910, scathing report. There were 177 medical schools at that time. They recommended half of them be closed down, that they were all apprenticeship programs at that time, that they should all be switched to the curriculum that was being promoted at University of Chicago and Rockefeller University. They then talked that they set up the John Hopkins University. I believe the director of that was Welsh. With that program, within 5 years, they were down to 75 medical schools in all the United States and Canada. All of them had the same curriculum as Rockefeller University had set up. And what they set up was, the whole purpose of their diagnostic systems was to increase the use of pharmaceuticals, not to find out what the problem was. It was to take care of symptoms, and that was to increase the use of pharmaceuticals. So they use lab tests. And if we go back into history where they came from, Louis Pasteur is a father of the germ theory. He believed germ A caused disease A, germ B disease B, and on down the line. And if you could just figure out what that germ was, he eradicated everybody to be fine. He spent his whole life doing it. He was from France. A contemporary of his, Claude Bernard, taught in the medical school in France, and he taught physical vitalism. It was the constitution, the strength of the body, that allowed disease to grow, the strength or the lack thereof. And at the end of Pasteur's life, he recognized he wasted his time. Claude Bernard was right, but it's easy to sell people on this pseudoscience. And I call it pseudo because it's all promoted with a bias, this narrow view, rather than exploring causation. The whole bias was to increase the use of pharmaceuticals. So the whole diagnostic system that people are used to is set up to increase use of pharmaceuticals, not to find root causes.
Gosh, it's fascinating to hear this and also kind of depressing,
Yeah,
because as just a typical person, we are taught to put our faith in doctors. And I know growing up as a kid, my mom and dad said, whatever the doctor says is right. You cannot question a doctor. They know what they're talking about. They've spent years in medical school. They know everything there is to know. But now, as an adult, I've been to many doctors in my life. And every time I ask them, well, have you ever experienced this? No. I'm like, well, then you don't really know, right? If they haven't experienced it, or if they're not um, coming at it from that angle, like you said, not just wanting to find the root cause, but kind of looking at the whole picture, not just prescribing prescription after prescription. And I so appreciate that you're a big believer in addressing the root cause rather than masking symptoms. And
yeah.
yeah, for those who are unfamiliar with functional medicine, what does root cause really mean? How would you explain that?
Real simple. When you look at, we deal with some of the worst chronic illnesses out there. So I'll give a perspective of Lyme disease. People are led to believe that's from a tick. That's not true. It's a fluid transfer disease, and anything that takes fluid from an infected host can spread it to anything else. Mosquitoes, gnats, sharing a milkshake, sexual fluids, breast milk, anything that takes fluid from one infected host, puts it to another, can spread it. All right. But what allows it to grow in the first place is something that beat up the immune system. Everybody thinks that they can chase the Borrelia infection. And if they can eradicate the Borrelia infection, back to Louis Pasteur, they'll be well again. It's not true. All of the ways that people are trying to do that don't work. The herbal ways that do that, the guy that came up with most herbal things died from Lyme disease. And when you look at the medical things, every study has failed. So we look at what set the stage. I see all these factors that are always the case to set the stage. Global fungal infections, Candida, leaky gut is a major issue. A lot of pathogens are growing inside the gut. A lot of food intolerances going inside the gut. That makes the whole body toxic. Half the immune system, more than half the immune system, is in the gut. It depresses the immune system because overwhelmed with toxicity, the immune system is a very, very poor detoxifier. So those toxins spill out globally. It dysregulates the hormones. It dysregulates every metabolic function there is. And then along comes the so-called the tick bite. But Lyme disease is a combination of Borrelia, which is the Lyme bacteria. It's actually hot-rodded syphilis is what it is. And along with that is Ehrlichia. It's a little round bacteria that invades your white blood cells, your immune cells, and depresses the immune system even further. There's a rickettsia. It's a little round bacteria that invades the lining of your gut and your blood vessels, so it makes your blood cells tumble down the arteries and the capillaries rather than slide like they're supposed to. Hyperinflammatory, causes clots and all that, makes it so your digestion's even worse. And this one-celled animal parasite that climbs inside your red blood cells and eats the inside of your red blood cells, which gives you anemia and all these things called babesia. And babesia is really close to malaria with these huge spike fevers. So that's the scenario of everybody. We've seen hundreds of people with Lyme disease with all that going on. Where's the Borrelia bacteria and all that?
Wow.
It takes us an average of somebody who's had maybe born with Lyme disease. Maybe had it for decades, been to all these specialists that can't do anything. It takes us an average of 6 to 8 weeks to get rid of the Borrelia bacteria, but they're not well because that's not what all the symptomatic picture comes out of. What set the stage is what takes the time to really heal somebody. And I'm told I'm the only one in the world that addresses this by people who've been in the industry, been to the best specialists. People have been to clinics at 50,000 a week. And nobody talks about what I talk about, and nobody has these results we have because they're all chasing Louis Pasteur's bad dream of
Hmm.
bug A causes disease A. And that's not the case. I don't think I've ever seen a case of Lyme disease. Some of Lyme disease, Lyme isn't even there. It's more babesia. But I've never seen a case of Lyme disease. And we've seen hundreds of cases that don't have at least 3 of those 4 infections.
Okay, you're blowing my mind right now.
I'm probably everybody's, but
Oh, yeah.
you ask that billion-dollar question, and people aren't ready for that answer.
On the one hand, I am so grateful for what you're saying, and it all makes so much sense. And there's another part of me that's angry at our healthcare system for hiding this and making us think that we need to pay a lot of money for drugs when we probably don't. Probably the answer is something really simple. And even the fact that we know now healing is not just physical, it's also emotional and spiritual too. So what are your thoughts on integrating those layers into the healing process?
It's a huge thing. I'm one of those rare individuals that got so many hats it sounds ridiculous. But I've been a minister for decades also, and I understand all of those roots. That's one aspect that empowers what we do. It's the Lord that directs. He shows us what's going on, and then he shows us ways to test to prove those things out. It shows us ways to resolve those and how to test to prove it's going to resolve it before you give it to somebody. And that's a mind blower. We can test somebody for thousands of miles away from us and prove a therapy is going to resolve their health before we give it. And that's how we assemble our care, is proving out exactly what they need, what doses they need of that, how to integrate that. And that's all going to change a bunch of times along the way. But the typical system of doing lab tests, you guess at what the lab tests mean. And then you guess at a therapy, you throw the therapy, and you say, come back in 6 to 8, 4, 6, 8 weeks, and we'll see how you're doing. In their 6 to 8 weeks, they've done all their tests, and it's going to take them weeks, maybe months, to get the results back. We do all our tests on day one. We have all the results on day one. So in a matter of a couple hours, we know exactly what's going on. And we've worked with people on a weekly basis. We get them started on whatever they need. We're checking in on a weekly basis. So by the time they go to their other doctor, we've had 7 visits on
Wow.
average. And a significant amount of whatever the infective issues is either gone, or like 75% gone by the time they even see their doctor for a second time. And we're constantly monitoring, retesting, and adjusting everything that goes on. So we're much, much, much more intimately involved with people as far as that goes. This buzzword of root cause is pretty common in the functional medicine realm, but very few people have the tools to actually find it. The medical doctors came into functional medicine many years ago, and they seduced people into getting out of the intuitive diagnostic procedures and using what they use as lab procedures. And everybody's doing lab procedures is guessing and throwing somebody else's guess at whatever your symptoms are, with no way to measure what's really going on. They talk about root cause, but they can't do it.
Yeah, that's so fascinating. And it reminds me of when we spoke earlier, the story you shared about helping your own mother, and just what a transformation that was. Would you mind sharing that story?
Yeah, it was really simple. My mother had diarrhea. She was like 93 at the time. She just turned 95 a couple days ago,
Aw.
a week ago, and she's still out golfing women in her 50s. They gave her a big trophy in this huge reception last year, just honoring somebody who's so vivacious at that age.
That's
She's
amazing.
looking older, but her mind's still bright, and she's pretty functional. So anyway, she had diarrhea for a few days. I was told it was longer than that. She says no, it wasn't. She couldn't get out of bed. She lost all her minerals, dehydrated, and all that. Neighbor is a paramedic and a nurse, and his wife was a nurse. They were called. They came over. They couldn't figure out what the problem was, and they all you have to do is ask a few questions, but they don't do it. And that's where we start off way different. You got to find the story what brought somebody to that place. If they would have asked, "Why are you in bed?" "Oh, if I got diarrhea for a few days," there should be this big bell that goes off. You're just depleted of all your minerals. Your electrolytes are just way off. And that's what that says. But they didn't get it. They called an ambulance, told them to roll in quietly. They came, checked them out. They couldn't figure anything out and said, well, let's take you to the hospital and see if we can figure it out. They took her to the hospital, did all their care, and they come up with this COVID pneumonia diagnosis. She's talking fine, breathing fine, and all that. They put her on oxygen. They called me up when they were moving her to hospice and asking for an okay with that. So they're setting her up to die, within a couple of days.
Wow.
I asked to talk to the nurse. I went over the lab stuff with the nurse, and I said, "What are you guys doing for calcium?" Said Tums. That's what they always use, and we don't absorb Tums. So anyway, I said, "Do you guys have access to calcium citrate?" He said, "Yeah." "Can you change the Tums to calcium citrate, minimum of 2,400 milligrams a day? And can you change the water she's drinking, the hospital water, to distilled water?" I just asked those two things. And it's really benign. They don't know why. It's pretty simple. It's not threatening. It's not accusational. I'm just being part of the team, going over stuff. They don't know I'm a doctor. Doesn't matter. But it was pretty benign. So the nurse talked to the doctor. Within a couple hours, they put her on that. 2 days later, she's off oxygen. 2 days later, she went home. And they think they did their magic. And I was talking to my mom and my brother at a table a couple of years later. That was might have been last year, the year before, at my mom's dining room table, and talked to her about what went on. She was so morphined out that she didn't know. And I told her what I did. And I said, what I did is I changed your electrolytes. I changed your pH. The calcium is your biggest mineral, acid busbuffer, and your buffer, and the other one's bicarbonate. So I gave her a whole bunch of calcium to buffer all the acidity from losing all her electrolytes. You can't absorb, carry, deliver, or utilize oxygen in an acidic environment. I just changed her pH. She started breathing, absorbing oxygen, and went home in 4 days. No idea what went on. She's too drugged out to know what happened. That's all.
That's
And
incredible.
and you can't absorb minerals out of your water. Distilled water is the highest energy water you can have, and the hospital waters can be toxic. So two very simple things.
Wow. I mean, a story like that where your mother was literally on her deathbed. They were asking for permission to move her to hospice care. And then in 4 days, you've not only saved her life, but she's going home in good spirits. Like, and now she's just celebrating her 95th birthday. I mean, that's incredible to me. Something that is so simple and straightforward. And yet our doctors and nurses are not taught to look at it in that way, let alone make these simple adjustments.
Yeah.
It's wild for me to think about. Um, Now, I know you've spent decades building your tool chest, if you will. What were some of the surprising tools or methods that people may not expect, but that can often make a difference?
Um, those are really, really huge. Um, the diagnostics is probably the biggest one. You had talked about trying to find doctors, and I'll say this, and then I'll answer that question. One of the best questions you can ever ask a doctor when you go in is what percentage of the people that have what you think I have, can you resolve that condition, make them healthy again? What percentage of those people? Second following question, how long does that take? Third following question is, what's that going to cost? I've worked with thousands of people, and I'm the only doc anyone's ever met that can answer any one of those three questions. And I do it with everyone
Wow.
before we start. So that's a huge thing. People think their whatever therapy is what's going to heal them. And with Lyme disease, people think they get rid of Borrelia, they're going to be healthy. I'll tell you right now, that's not the case.
Mm.
Just it's absolutely not the case. You look at the forums, people are YouTube PhDs on being sick with no concept about how to get well. And they're so stuck in their mindset of being sick and being these educated idiots on being sick that they're just not open to what it takes to heal. And that's really sad. But that's one of the things. And we look at what sets all that stage. We look at diagnostics. You look at Lyme disease, for instance. The best Lyme lab in the world used to have on their website, their tests were 0 to 20% accurate if you got a blood sample in the first 1 to 2 weeks of infection, but never happens. Now they just have on their website, their tests are not a diagnosis. So that's pretty mind blowing. If you look at the lab tests for food intolerances, 2 to 3% accurate. That's all. They only know what 2 to 3% of their responses are. That's all they can test. Everything else is all over the map. You look at the studies of people with fungal infections, with cancer. Almost everybody dies from a fungal infection with cancer. No clinical relevance to what's going on to direct care to give any benefit whatsoever. That's the research that's out there. And it just goes down the line without all these fancy tests for these functional medicine tests. No clinical relevance. And we see people come in with those tests, and it has no clinical relevance to what's going on and what they need to heal. So lab tests, although we've been seduced, the seduction was with Rockefeller to lie to everybody to increase the use of some therapeutic intervention to reduce your symptoms, not to deal with the cause. And that's a bold statement, but that is a fact. It's a historical fact.
Hmm.
So that's not the way you find these things out. The um, so there's three other kinds of diagnostics. There's dark field or live cell analysis. I was at a Lyme forum where the top researcher in Lyme disease was he's the head of the pathology department in research hospital, and he's talking about different things. I asked about the dark field, and he goes, "Well, the problem with dark field is you can't identify species. You can see a shape, you can only guess what that is. So you see a corkscrew bacteria go through. Is that Lyme disease? Is that syphilis? Something benign? No way to tell." And I go, okay. And there's nothing else to discuss with me because he answered all of the questions in that simple statement. No reason. I'm not married to anything. I've got a lot of questions and I just want answers. And the right answer directs you on where you go. The electrical diagnostics, the research shows that it's reasonably accurate in what it finds, but it can't still tell the extent or the cause. Without knowing what the cause is, therapeutic intervention just doesn't work. In the last form, 95 to 97% accurate. In the double blind studies, even on PubMed, is muscle testing. Muscle testing is a lot of people stay away from that because they think it's cultic, they think it's all kinds of other things. It's never explained properly. It all works off of um, quantum physics and the reality that all these atoms that are out there, they're not what we're taught in school. They're literally electromagnetic pumps, and as these orbitals move around, this electrical magnetic thing pumps back and forth. And muscle testing ties in to test the integrity of that electromagnetic pump into every organ system there is in the body. And you can use that to challenge whatever's going on. There's a couple of ways to do it. It's the most accurate form there is, but it's subject to the influences of the tester. So if the tester has a bias, it's completely invalid. But all of the lab tests were set up with a bias. So for somebody to be able to be accurate with that, they can't try to put people in their favorite box. They got to test extensively and let the results tell them what's going on, not what their favorite thing is.
I mean, I wish I could keep talking to you forever. I'm learning so much. We do need to wind down. I've got one last question for you as we wrap up here. If you could speak directly to someone who feels like their body has betrayed them, like they're never going to get better, what would you want them to know right now?
Real simple. We work with some of the sickest people out there that have been to all the specialists and just exhausted all their resources, the specialists, economics, and all that. One of the most common things that people say working with us is, "You gave me my life back." And that's really, really common. It only can happen when you're really dealing with all these root issues. And these are people who couldn't walk, couldn't talk, did not have any cognitive function, could not get out of bed, couldn't go from the bedroom to the bathroom. Those are the people that say, "You gave me my life back." Not cherry picking. Those are the people who've been to the best clinics and specialists that they can find. So this issue of you're going to have this forever is not true. That young I'm not sure if I talked about that young gal. I think I did. Um, she hadn't cycled, one of the girls with Lyme, she hadn't cycled in over a year when she's a teen. She was told she'd never have children. She's got two happy, healthy young children now just because she went through the process. It was fairly difficult. The only way you're going to make a change is to change what you're doing. And the system that most people are in, looking for answers, cannot give them the answers because it's not in the education of any of the schools that produce doctors. It's not in medical schools, not in chiropractic schools, homeopathic schools, or naturopathic. They don't teach how to deal and resolve chronic illness. You got to go outside of the system. I've been outside for 40 years studying this, and that's why we specialize in it. I was there. I had to figure out how to get out myself because no one else could help. And all the tools that I got along the way is what we use to develop. You look at testing issues, the top functional medicine doc in the world has 100 different tests that they do for their intake. We're 4.5 times that.
Wow.
A good
That's
friend of mine's the number one functional medicine doc, different part of the country, 52 metabolic tests. We're 5 times that.
wow.
That's why we get the results we do. We test things to minutia levels at everybody on day one, so we can really figure out what they are. You can't do it with other people's systems. So you got to change what you're doing to get different results. And it takes that kind of intensity of interaction care, diagnostics, and testing of what people need so they can get there. So we got two guarantees with what we do. I'm told there's no guarantees in healthcare. Our first guarantee is if we can't find out what the root cause are and how to resolve those, I don't charge anybody. We go our separate ways. In 40 years, no one's ever taken me up on that guarantee. So I can always find it. The other one is if in 6 months of care, if you can prove you've done what I told you to do and we haven't made significant improvement in effective and metabolic functions, I'll continue to work for free. No one's ever taken me up on that because if they do what we do, what we tell them to do, they'll get better.
That's incredible. I am so inspired by you, and I feel like I need to take a good hard look at my own body and my own habits. So, Dr. Brad, thank you so much. You have reminded us that healing isn't about masking pain, it's about pursuing truth. And whether you've been told there's no hope or you felt unseen by traditional systems, Dr. Brad is proof that restoration is possible and that the root cause healing can truly change your life. To learn more about Dr. Brad's work and how to connect with his practice, check out the link in our show notes. And remember, free spirits, keep questioning, keep exploring, and of course, keep flying upstream.